All right, so we've been warning you about those respiratory viruses, especially the flu, are quickly ramping up with the holidays behind us and children back in schools.
We're hearing about it in schools. We're seeing it in the ER rooms. So that's why we are bringing in Dr. Frank McGeorge to give us a little perspective on what's going around.
Yeah, Karen and Damon, in the ER at Henry Ford Hospital where I work, the flu has been on a steady increase, pretty much in line with what other doctors are seeing around Metro Detroit. But that's not the only thing spreading in the community. Stomach viruses are popping up in a couple of counties as well.
In Wayne County, Dr. Kevin Daisy at Children's Hospital reports RSV, COVID, and the flu in kids. The good news, he thinks we may be past the peak of RSV season. Dr. Christopher Lowe at Ascension St. John says he's seeing the same, and Dr. Jennifer Stevenson at Henry Ford Fairlane adds strep throat to the list. Over to Oakland County, where Dr. Tim O'Neill at Clarkson Medical Group reports the flu is on top of his list, but he's also seeing some cases of COVID, RSV, and hand, foot, and mouth disease, which is also caused by a virus. Dr. Stephen McGraw at Ascension Providence in Southfield and Novi say the same respiratory viruses are circulating in his area with the addition of stomach viruses. Henry Ford West Bloomfield is also reporting stomach viruses on the rise. West to Washtenaw County, Dr. Brad Uran at Michigan Medicine reports a lot of COVID, flu, and RSV. He also says the changing weather has irritated the airways of people with asthma and COPD. The Washtenaw County Health Department reports influenza cases are on the rise, with a similar increase in flu hospitalizations. They also report their first influenza death in an older adult last week. Finally, in Macomb County, Dr. Joseph Charlier at McLaren Macomb is reporting a high volume of stomach viruses causing nausea, vomiting, and diarrhea. Viral upper respiratory infections from the flu, RSV, and COVID also make the list, and he points out that the COVID they're seeing is mild, not requiring hospitalizations. Dr. Marissa Samuel at Henry Ford Sterling Heights says viral respiratory infections are dominant there.
Now, another thing one of our doctors mentioned is that especially with the expectation of some snowfall this weekend, please take care when shoveling and kind of ease into it. Your back and your heart are going to thank you for the consideration. And remember, you and I are a year older than the last time we shoveled.
That's a good reminder, because so many people just grab that shovel and head on out.
I know. And I can only imagine that many of us know someone who's experienced symptoms recently. So if someone does, Doc, come down with some stomach virus symptoms, when should they call the doctor?
Well, so if you're feeling dehydrated, that's definitely a time to go. If you can't hold liquids down, another one. High fevers, any localized belly pain, especially if it's in the right lower abdomen, for example, or if you have any blood in your stool. Those are all symptoms that you should call your doctor about.
Good to know. Thanks, Doc.
Sure.